Touré. I'm the head of communications at the Partnership for Maternal, Newborn and Child Health. I have the pleasure of being in Johannesburg in South Africa, attending the G20 Social Summit this week. And I'm joined by Levy Singh, who is the Y20 Sherpa here with us, and who will just walk us through a couple of questions to help us understand what we're doing here. So, Levy, what is the Social Summit? What's the G20 Social Summit, and why are we here?
Well, thank you, Kari, and welcome to South Africa. It's lovely to have you here. So the G20 Social Summit is a priority of the South African presidency to bring the voices of the citizens of the G20 nations closer to the process. The G20 Social Fest happened last year in Brazil. It's the first time that the G20 Social Summit is happening on African soil, which is remarkable. And ultimately, the Social Summit is really shaped around the agendas of the engagement groups, the 13 official engagement groups for the G20, Y20, Women's 20, Civil Society 20, Labour 20, you can name them. But I think what's been extraordinary under the South African presidency is that we've expanded to some of the informal and unrecognized engagement groups. So Children's 20 is one that has been recognized for the purposes of the South African Social Summit, as well as Interfaith 20 and a few other actors. So it's really a cauldron of ideas to strengthen multilateral cooperation, but also to strengthen the voice and participation of average citizens in the G20 processes.
Super. And so you've participated in a side event this morning focused on women's, children's, and adolescent health. And as the Y20 leader, you've also been in conversations around priorities of young people for the continent and broader. What are some of the ways in which women's, children's, and adolescent health priorities are being filtered into G20 conversations?
So as a Y20, very early on in our presidency, we had engaged with the South African G20 presidency to look at what are some of the intersections of our priorities. As a Y20 presidency, we were very deliberate about also aligning our program of action and our lobbying and our advocacy with Agenda 2030 and Agenda 2063, especially because this is the first time that the EU is a full member of the G20. And one of the main things that we had prioritized, at least under our thematic track area 5, on fighting inequalities, was this issue of advancing an annual ministerial discussion on women, children and adolescent health in the context of the G20 through the Ministerial Health Working Group. We didn't necessarily find consensus on that within the Y20 summit itself. However, as the presidency, we still maintain that the Global Leaders Network for Women, Children and Adolescent Health should be a legacy project that we continue to support as the Y20 over the next 5 years. And that's really been one of the priorities for us. I think in terms of the broader political recognition of adolescents as a unique demographic cohort, especially on the African continent, is something that we want to continue advancing in collaboration with some of the other countries in the Global South that are G20 members, like Brazil, like Mexico, like India. India was quite phenomenal in 2023. They had identified adolescents in their overarching G20 program, and we've been coordinating with them since then to ensure that we have some continuity on that agenda. But it is tough, I won't lie. It is really tough, especially because many of the global north countries that would ordinarily speak up in support of adolescents don't locate adolescents in a space like the G20. So I think we've still got lots of work to do, but it's really about building alliances and continuing that lobbying and advocacy.
And it seems like it's an influence that's even going beyond the G20, because the issue that you mentioned around institutionalizing reporting and conversations on women's, children's, and adolescent health did come up quite often in the meeting this morning, with recommendations that it be institutionalized as well in regional processes like the African Union. So the recommendations that you are making are being heard, whether in the G20 processes or beyond. So I guess maybe this last question, where do we go from here? So we've had events, you've had the presidency, we're having meetings. What does that mean for how these get integrated into the outcome documents of the social summit, and then to the leaders' declaration here, and then in terms of its influence in multilateral processes moving forward?
That's a very loaded question.
Very big.
This time of the day. But the social summit, as we've just heard from Deputy President Paul Mashatile, is hinged on 5 key priorities. And one of the key priorities is looking at building momentum for Agendas 2030 and Agendas 2063. As Africa and as South Africa, we're greatly concerned at the lack of progress around the SDGs. I mean, only 18% of targets and indicators are on track as per the last SDG review. When you look at Agenda 2063, data is a bit more patchy in terms of its 10-year implementation plan. So development is under threat, and the current geopolitical environment is also undermining development gains. Also considering the fact that we've come out of a pandemic 5 years ago that had dramatic effects on development outcomes across the global south, we're trying to say we need a future-fit agenda. We need to keep member states committed to seeing out the next 60 months between now and 2030. We need to galvanize and embolden further commitments towards Agendas 2030 and Agendas 2063, but in particular SDGs 3, 4, 5, and 10. That inequalities issue has really been a core issue of our presidency, and we'd really need to consider how to accelerate progress, in particular through locating the Pact of the Future and its commitments, in particular the Declaration on Future Generations, in the G20 discourse, and then really just realizing that the G20 is an informal platform. It doesn't have a constitution, it doesn't have a secretariat, so ultimately we have to focus our advocacy on regional economic commissions on the African continent, but more so we have to focus on the African Union and strengthen the African Union. It was great that NEPAD was here as the official development agency of the African Union that really spoke in support of the adolescent health and well-being agenda through harnessing the demographic dividend. So working with core players like that to infuse and embolden political action through the African Union space, but then also then turning our eyes to the United Nations and ensuring that the United Nations, in particular the Commission on the Status of Women, the Commission on Population Development, as well as the high-level political forum, really are protected and are mobilized around as member states in the global south for us to advance the SDGs and protect development outcomes as it pertains to our agenda.
So one step in a very long, I guess, process of setting development priorities and then seeing them through, right? We know the commitments have been made to these issues. It's because of actors like you that those commitments are translated into actions. You play an exceptional role in holding governments to account, but also holding development partners and ourselves to account. And it's been an absolute pleasure having you here with us. Thank you so much, Levy.
Thank you, Kari. Thank you to the GLN and PMNCH.
Yay!